Now here's your host, Ken Gross.
Good morning. Welcome to Law and Reality. Today's segment, we're going to cover Metro Detroit Health Insurance Program. Let me introduce Tom Berkowitz. Tom, welcome to the show.
Thanks, Ken. Thanks for having me.
But the Metro Detroit Health Insurance Program is a unique story, and I want to go through and explain to you why we're covering. It's a charity, and I would say with extremely unique features. And these are the two that I think are the most unique, that intrigue me. One is there is no overhead. All people that are involved in the charity are working without compensation, donating their time, and 100% of all contributions to the charity go to help those that are intended to be helped by the charity.
You know, that's
if
fantastic.
You think about it, you never hear of that.
I just saw an article, I don't remember if it was yesterday or where it talked about the percentages of money that go to the charities each gain, and it's amazing. There are some like that 93, 95% go, and then they had some on there that I was very disappointed. Like the American Red Cross, had a very, very low contribution rate by the dollars that they gain against what they contribute out and distribute to the public.
Absolutely. Let's not get too bogged down on that because I want to get to what Tom's charity is about. And first of all, Tom is the board president and volunteer administrator and founder. Grew up in Oak Park. You got a BA in education from U of M. What does Metro Detroit Health Insurance Program do? How does it work?
Well, it works by providing financial assistance to low-income uninsured people. The Affordable Care Act, whether you like it,
also known as
Obamacare, whether you like it or not, it's the law of the land, and there's subsidies offered to low-income people. Okay, anybody making 400% of the poverty level or below gets some kind of subsidies, and it gets larger and larger until you get down to the people that are close to Medicaid, which is 138% of the poverty level.
So if you get the subsidy, what do we need? What does the charity do?
The charity fills the gap. For example, people making minimum wage full time, that actually makes too much for Medicaid, but they get very large subsidies. You know, the problem is that even though the insurance may be discounted 80% or 90%, they still can't pay
can't
it.
afford the other 20%.
They're living paycheck to paycheck. It's impossible. Even if it's a $600 a month, value, that's to them $80 a month. They don't have $80 a month.
And then if I'm correct, if they don't actually have the health insurance and they have income, then they could be penalized on their taxes under the
It's
Affordable
really
Care Act,
harsh.
right?
You know, the low income people really are hit hardest by the penalty. Maybe I should say the Affordable Care Act now requires people to have health insurance. It's the law. You have to have health insurance if you make more than the Medicaid income level.
And then if
you don't,
you get penalized.
You get penalized. So here, the poor people.
And then they come to Jenny with a tax problem.
Yeah. And it's going to be a big problem.
I'm seeing a lot of them right now being
It's going to be a
penalized
big
for no health
problem. I think that in 2016, the penalty goes up to $695 per adult.
But if I understand it correctly, what it comes down to is people are, if you're above the Medicaid level for income, but below reasonable compensation, you don't have enough money to pay for the insurance, even your share.
Right.
Your charity is covering that gap.
We fill the gap between what they can afford and what the cost is. I started it, came up with the idea. I went and sought out a nonprofit who allowed me to run a pilot program, which is running this year. And they kind of wanted to keep it quiet because
see how it goes.
See how it goes first. We had about 50 or 60 families in it. And it's been going great. They're so appreciative, and
it's an absolute win-win situation for the people that go to the organization. But how does it work? So as I understand, if you're uninsured and you earn too much from Medicaid,
right,
but earn below the 200% poverty level, that would be the
our
range.
Niche. That's a great topic.
What's the difference between bronze plan and silver
There's
plan?
There's bronze, silver, gold, and platinum.
Right.
Okay, and this is designed to try and get people up to silver, right?
Yeah, we only allow silver plans. Bronze plans have deductibles of like $5,000, $7,000, $9,000, $11,000. A poor person can't ever use that
Yeah, your
Well,
bronze
they
plan
can
is
use
the equivalent
They can use
of
it this way.
They can use the free.
They're complying with the law. They
Right.
can go to the doctor. They don't pay the deductible. Then they
Exactly.
come to Brian to discharge the obligation
The
in
bronze
bankruptcy if necessary, and they go to Jen. And those that don't do the bronze plan and end up getting stuck with the tax liability go to Jenny to help them with the tax problem.
Do you remember?
Just trying to
you used
solve
to
the problem
have
for everybody.
you used to have people that had catastrophic coverage only.
That's what bronze
That's
is.
basically the equivalent of bronze plan. If you
by-
need health insurance and you're in a
And
hospital,
by definition, the person that's
That's
going
where
to
it
go to
goes.
the bronze plan is the poorest, lowest income person because it's the most
Or the
affordable, and it's the
healthiest.
least thing that they could possibly afford.
It's a
because
way
of
to
the
get out
cost.
of the penalty, and that's about it.
That's it.
Yeah,
So
So
that's
what
the big
is
thing.
the silver plan?
The
Silver
silver
does you what?
plan
Good question, Jenny.
is there's a special provision for the silver plan where government provides cost sharing to low-income people who buy the silver plan. That's why we go for it. The government sort of buys down, or probably offers the insurance company money to provide very low deductible, very low max out of pocket, very low copay. So they're tailor-made for low-income people
the
to actually
sil-
be able to use
So
them.
the silver plan has a variability to
Yeah.
it that if your
Even
income
the
is
gold-
low enough,
Yes, even the gold and platinum don't offer that. The silver
Is
is
the one
really
designed.
tailor-made, and we only provide assistance for those to get silver
So
plans.
realistically, you're probably more familiar with the Affordable Care Act than most people with all the work that you've done.
Most people don't even know
Really,
that
they
it's the
should-
law you have to have insurance.
They
I
should
think.
have never had the bronze plan to begin with. They should have started with the silver. Poor people should not be, low income people, I don't like to say poor people, but low income people should not be pushed into the bronze plan because they can't afford the deductible.
No,
But
they're being
without our
pushed into-
assistance, they
They have
have
no
no
choice.
choice.
Yeah,
They
that-
either, like you said, have a penalty, or they throw money away on a bronze plan that's not going to help them if they have a serious illness.
Yeah, and realistically, the penalty is as much as the cost of the insurance.
Yeah, that's why they buy bronze plans.
Yeah.
If they know about it. There's a huge problem.
Yeah,
On
big
the
gap
low-income people don't even know that there's subsidies. They don't know that it's the law. A lot of people are going to get hit with penalties.
I mean,
And you know, it's
I mean,
also
that's
really
total surprise.
People all know about
Yeah.
Obamacare, Affordable Care, and the requirement, but they don't understand the parameters and the
Yeah.
requirements. And when you watch it on television, you don't get clarity to really understand what your
Yeah,
obligations
they're not really
are.
putting out there, maybe for political reasons, about the penalties that people are going to face.
Yeah.
So
Yeah,
how
it
do
could be
people
tough.
go? Do they go to your website to apply for the program?
No, actually, I'm glad you asked that. We have partnered with many this is what I've been doing for a year, calling and trying to find social service agencies that partner with us. And I've been doing,
Yeah, so
I'm
you have
pleased
like
to
this
say we have like
34
34 different enrollment places around the Metro Detroit area
and
where
you can
people can go.
and you can find all of them on
the
the
website.
We got a couple minutes left. Give me what things do you want to leave us about MDHIP so that people know?
Yeah, well, I really want to stress, when I created this, I was really looking for a place to make a huge difference with no overhead. And in our program, like I said, we have no overhead. I pay our phone line myself, and that's about all. Their P.O. box, you know.
There's also a match on the
Yeah,
contributions. isn't
there's
there?
100% match to contributions, but the real beauty of the program is that we can piggyback off the federal tax subsidies. So, for example, you know, a person may get a $5,000 subsidy, but they can't take advantage of it. But if we can add another $500 to what they would have to pay to get it, then suddenly they have, you know,
Well, let me put it
like
in
for
numbers.
each dollar. Let me just say, for
yeah.
each dollar donated, we can buy insurance from $5 to $70 for each dollar,
the
depending
dollar
on the
donated,
recipient.
The dollar match is $2, you get $70 donated out of it. So if we
Right, it's a
so I
huge
sent you a
impact.
check for $250, all of a sudden we're
Yeah, it's
buying
worth thousands
50
of dollars
yeah.
of insurance.
It's really a great thing. And the thing is, for people that, first of all, if you're in that situation, there's no reason not to do this. This is a great thing. There's no catches. And if you go to the website, mdhip.org, you will see that it's very user-friendly. The forms to fill out are very simple. It's not like you're going to a government situation where you got like a 40-page form to fill out. I was amazed at how simple of a process it is. And in order to get that information, I want people to know, go to mdhip.org, and on that if you need assistance, there's the 34 locations are listed on the website in the Tri-County area. I'm assuming you can go to those organizations and they'll help you complete the forms.
Yes.
And get
Most people,
things that you need
the
to
open
know.
enrollment is starts November 15th. Unless you have a special situation like a job change or a child, you have to wait till November 15th to
And
get
if
enrolled.
I want to email you to get more information, I should email you at info@mdhip.org.
Yeah, and anybody who thinks they qualify for the program and wants to find out, they can email me with their gross income, 2016 expected gross income, family size, and I'll email them back as to whether we can help them.
I want to kind of wrap things up to say the reason why I had you on the show is because you're doing something 150% pure charitable. There's nothing in it for this guy at all. All the time, everyone in the organization is working for free. You've got a founder that's doubling, a benefactor that's doubling the contributions that are made. I wish there were more people like Tom Berkowitz out there.
Well, and thank you for donating.
I appreciate the faith.
Fav Gross, by the way, is a donor to our program, and thank you so much for having me on.
Thanks for being with us, Tom. Good luck with the charity.
Thank you very much.